Hey gang, Joe Cannon from supplementclarity.com. Today I want to talk about blood pressure, specifically give you some ways in which you can help lower your blood pressure naturally. I know a lot of you ask me these questions, hey, my blood pressure is a little high. How can I lower it? I don't want to go on a medication. Okay, well, sometimes we have to go on medications, but there are some things we can do to lower our blood pressure on our own. Sometimes we may not even need medications, okay? What I want to talk about today is a video component of a larger review that I posted on my joe-cannon.com website, and I'll put a link to that in the description so you can check out the whole thing. But here I want to cover 7 science-proven ways to lower your blood pressure naturally. Some of these topics you've probably heard of, but I'll bet you some of these you have never heard of. Okay, so let's just jump right into it and see what we can figure out. So, number 1, weight loss. You're probably aware that losing weight can help people lose or lower their blood pressure, but it doesn't take a lot of weight loss, okay? So, for instance, here is a study from 2000, overweight, obesity, and blood pressure, the effects of modest weight reduction. We're not talking about a lot. We're talking between 5 and 10% of body weight. These researchers noted that just modest weight loss resulted in an improvement in insulin sensitivity, that's good for people with type 2 diabetes, and a decrease in blood pressure that was actually independent of reducing salt. Obviously, cutting sodium will work even better with this, but these individuals apparently didn't even do that. So that, again, we're not talking about a lot of weight loss. Again, 5 to 10% is not a lot, and I'll show you in a second what I'm talking about here. Here's another investigation from 2019. Dietary weight loss intervention improves subclinical atherosclerosis, hardening of the arteries, and oxidative stress, free radical damage, and markers in leukocytes of overweight individuals. This was a study of 59 people, and they went on a 6-month weight loss program. And after they lost weight, these researchers noticed patients' basically their BMI and their body weight went down, their blood pressure went down, they had a reduced inflammation response, less free radical damage as well, just from losing a little bit of weight. So again, basically what these researchers are looking at is they wanted to see if weight loss could improve essentially hardening of the arteries, and they found that, yeah, it actually did do that. Free radical damage went down, blood pressure went down, body weight went down, BMI went down. So again, what are we looking at here? 5 to 10% of your body weight. All you got to do is find your current body weight, get on a scale, multiply that number, whatever it is, by either 0.05 or 0.1. For example, if you weighed 200 pounds, 200 times 0.05 is only 10 pounds. If you were 200 pounds, 0.1, 20 pounds. So we're not talking about an awful lot of weight. This is definitely something that's doable by cutting a little bit of calories, not going on any crazy diets or anything like that, just cutting back a little bit on the food you eat during the day, and you're probably going to lose between 1 and 2 pounds a week. That's perfectly fine, and that's in the realm of normal for terms of weight loss. Again, we're not looking at like 5 and 10 and 15 pounds a week. That's just not going to be healthy. Half a pound, 1 pound, 2 pounds a week, perfectly fine. Okay, again, doesn't take a lot of weight to do this. But okay, so weight loss. You've probably heard about how weight loss can help blood pressure. Great. Let's move on. How about alcohol? Alcohol has been getting a pass for years because it's supposed to be heart healthy and raise your good cholesterol levels. These researchers put it very subtly, if you will. Alcohol is bad for blood pressure. Okay, they're saying in this individual investigation, increase in blood pressure is approximately 1 point for every 10 grams of alcohol consumed. How much is 10 grams? That's about a glass of beer or a glass of wine. Okay. Now, fortunately, they're also pointing out this also thing that this increase in blood pressure is probably going to go away within about a month after you stop drinking excess alcohol. Again, when I say excess alcohol, again, I'm going to be a little militant when it comes to this. I don't think there's any safe amount of alcohol, to be perfectly honest with you. Alcohol is associated with various cancers. Yeah, it'll raise your good cholesterol level. Okay, that's wonderful. But you got to take the good and the bad. So okay, it might boost your good cholesterol level, but it could also raise your blood pressure. Okay, so if you're looking to raise your good cholesterol levels, go out and take a walk. taking a walk, exercise is also very effective at increasing good cholesterol levels. Okay, so that's something you can look at. So I'm pointing this out because I don't want anybody to rationalize, well, I got to have a glass of wine a day or a glass of beer a day because it's good for my good cholesterol, my HDL, my high density lipoprotein. You're going to get the same benefits by taking a walk or going to the gym or something like that. Okay, but again, in terms of blood pressure, alcohol bad. Now, flax seeds. I will bet you most of you had probably never heard that flax seeds can lower blood pressure. Here's a picture of flaxseed that I actually grab from the supermarket and throw in smoothies myself. Okay, so here's some of the evidence that flaxseed can lower blood pressure. So potent antihypertensive action of dietary flaxseed in hypertensive individuals. So essentially, these researchers gave people with high blood pressure 30 grams of ground flaxseed a day or a placebo for 6 months. 30 grams is 1 ounce. Not a lot, okay? And after these 6 months, systolic blood pressure went down by 10 points. Diastolic blood pressure went down by 7 points. That is huge. And these researchers summed it up this way. Flax seeds induced one of the most potent antihypertensive effects achieved by a dietary intervention. Wow, I don't see words like that in many clinical investigations. They basically said it was a huge beneficial effect. Again, flax seeds are cheap. You can go to any supermarket and you buy them. Again, ground flax seeds are even better. So you can get ground flax seeds or milled flax seeds, same thing. If you want to use the whole flax seeds, you can throw them in a coffee grinder and grind them up that way and put them in yogurt, put them in smoothies. But again, only takes about 1 ounce to do this. This is amazing. Here is another investigation. The effects of flaxseed supplements on blood pressure, a systematic review and meta-analysis of controlled clinical trials. These individuals looked at 15 previous studies of flax seeds involving over 1,300 people, and they noted there was a greater effect on both systolic and diastolic blood pressure when flax seeds were used after 12 weeks, basically 3 months, okay? So they sum it up by saying this meta-analysis of randomized controlled trials shows significant reductions in both systolic and diastolic blood pressure following supplementation with various flaxseed products. Again, doesn't matter if it's an expensive flaxseed product or organic. If you want to do all that, great. But flax seeds alone seem to have this. So don't we all have our different brands we may like, but whatever you can afford is going to work perfectly fine for you. And again, the good news is flax seeds not that expensive. Reduce sodium. We all know about that. Sodium is a big driver of blood pressure. American Heart Association recommends we get no more than 2,300 milligrams a day at the most. 1,500 milligrams is even better for lowering blood pressure. What's that look like? Again, 2,300 milligrams. That's about a teaspoon of salt. Again, if you are salting your food, just pushing the salt shaker away and not using that can go a long way to helping lower your blood pressure. Okay. Now, we just don't want to look at the salt shaker, by the way, because salt is in a variety of foods. My rule of thumb is this. If the food comes in a can, if the food comes in a box or in some kind of a package, odds are it's going to have sodium in there. Okay. And again, spaghetti sauce is huge. You like organic frozen meals? Turn around and look at the label. You're going to see a lot of salt in organic frozen food. So we know about chicken breast. They inject salt into chicken breast and turkey breast, pancake mix, lunch meats, we know about that. Again, canned soups. For example, here is a common soup that I actually found in my cupboard in my kitchen. And it says reduced sodium. Notice it doesn't say low sodium. It says reduced sodium, okay? Now, you might think, oh, that's good. But if you turn it around and look at the sodium, it says in 1 cup, which is half of this thing, you're getting 480 milligrams of sodium. Okay, what does that mean? That's giving you 20% of your daily value for sodium. These daily values, these percentages you see here on the food labels, these are very, very important because they can help you analyze whether a food is going to have a lot of something or a little something. The thing to remember when it comes to the daily values is this. For instance, here is a basic nutrition facts label. Go into your kitchen. You can find these right now. When you look at these daily value levels, okay, remember two things and two things only. If you see 5% or less, it means it's low in that nutrient. If you see 20% or more, it means it's high in that nutrient. So whatever this is, you see 20%, 21%, high in sodium. If we go back to Progresso here, this is reduced sodium, we see it's still high in sodium. And again, that's if you eat 1 cup, half of this thing. If you eat the whole darn thing, which we all do, we know we do, you're getting 40% in this particular example of your sodium allowance for the day. And that's what these daily values are. These are recommendations of how much sodium you should be getting in per day, sodium, fiber, etc. per day, not just sodium. But if you remember, 5% or less, it's low in that nutrient. 20% or more, it's high in that nutrient. So ideally, you want to see things like low numbers next to sodium, for instance. You want to see low numbers next to saturated fat. We don't see that here, by the way. We want to see high numbers next to things like dietary fiber. Okay, that would be great. So again, just remember that the daily values are your friend. And if you remember, 5% or low is lower in that nutrient, 20% or more is high in that nutrient, you can quickly analyze the content of every food almost that you see in the supermarket or it's in your cupboard right now. Go check. Stop this video and go look for yourself. Now, sodium raises blood pressure. Potassium lowers blood pressure. Again, potassium is huge for lowering blood pressure. So for instance, here is an investigation. This has come out in 2006. The role of potassium in regulating blood flow and blood pressure. Dietary supplementation with potassium can lower blood pressure in normal and in some people with high blood pressure. It takes about 4 weeks to do that, okay? Again, this is important to know. Now, what foods have potassium? Easy way to remember foods that have potassium. You ready? Fruits and vegetables. If it's a fruit, if it's a vegetable, it's going to have potassium. That's if you just remember that, you're going to be doing a really good way to raise your potassium levels in your body. Okay, just a few foods right here. Avocado, one serving's got about 670 milligrams. Baked potato coming in at 900 milligrams. Now, what does that all mean, by the way? The RDA for potassium is about 4,700 milligrams a day, 4.7 grams a day. So one baked potato is really getting you almost a quarter of the way to where you got to be. Okay, that's important to remember because when I said potassium, odds are pretty much everybody listening to me said, "Ooh, banana." Where's banana on this? Banana clocks in at around 400 milligrams of potassium. Again, that's not bad, but bananas are not the highest amount of potassium in foods. And again, they have their place, but I want you to realize that any fruit, any vegetable is going to have potassium. Okay, broccoli's got almost as much potassium as a banana. Doesn't mean don't eat bananas. Bananas are great, but realize that you can get potassium in other things as well. Okay. Hibiscus tea, number 6. This is another thing that odds are most people have never heard that can lower blood pressure. There are clinical studies on hibiscus tea showing it can actually reduce blood pressure. This is a picture of my refrigerator. You can see I like to make hibiscus tea as well. So here is a study, hibiscus in the treatment of hypertension and hyperlipidemia, high cholesterol levels, a comprehensive review of animal and human studies. These researchers show animal studies have consistently shown that consumption of hibiscus extract reduces blood pressure in a dose-dependent manner. In other words, the more you use, the better. In randomized controlled trials, the daily consumption of tea or extract produced from hibiscus significantly lowers blood pressure, systolic blood pressure, and diastolic blood pressure in people with moderate blood pressure and even type 2 diabetes. In addition, hibiscus tea was as effective at lowering blood pressure as a commonly used blood pressure medication. It was less effective as other medications, but again, in terms of some medications, hibiscus tea worked as well. Again, that's huge. Here's another investigation. Effects of aqueous extract of hibiscus on the renin-angiotensin and aldosterone system in Nigerians with mild to moderate essential hypertension, a comprehensive study with a blood pressure drug called lisinopril. I always butcher that name. What are they saying? Hibiscus tea significantly reduced systolic blood pressure after 2 weeks, okay? The effects of hibiscus and the drug on diastolic blood pressure were significant after 3 to 4 weeks compared to placebo. That's huge. So again, interestingly enough, they're in this particular study, they're saying hibiscus was as effective as this particular drug, lisinopril, but in this other study, they're saying it was less effective as lisinopril. In other words, the take-home message here is hibiscus tea can lower blood pressure. Now, I'm not saying get off your blood pressure medicines. I'm saying that if you're drinking hibiscus tea a couple times a day or a few times a week, after a few weeks, check your blood pressure again and see if it has gone down. Okay, according to research like this, it seems like it would. Now, one of the things that I'll even do is, you see that I've actually make hibiscus tea myself. I will even take the tea bags themselves. I'll tear them open and I'll throw them in smoothies. Again, why not? It's the tea, and you don't just have to drink it. Why not throw it in smoothies and eat the whole darn food itself? Because tea is a food, by the way. It's an herbal product. Now, again, I don't even have blood pressure issues. But again, this is just something when I came across it, I'm like, you know what? What the heck? I like hibiscus tea anyway, and it can't hurt, so I'm using it. Now, number 7. Aged garlic extract. This is a dietary supplement that I have been talking about for a long time. It is not garlic. It is an extract of garlic made by a company called Wakanaga. It's called Kyolic aged garlic extract. This is available in any health food store in America, and it's not expensive, which is even more impressive to me. There is an impressive amount of clinical studies on Kyolic aged garlic extract showing that it has beneficial effects on a wide array of problems, okay? It can help them. So for instance, if we look at, for instance, the blood pressure issue, aged garlic extract reduces blood pressure in people with hypertension, a dose-response trial. This study came out in 2013. These individuals noted that average systolic blood pressure was significantly reduced by about 11, almost 12 points in the aged garlic extract group, basically 2 capsules a day. That's all it took, and it took 12 weeks to see this effect. Our trial suggests aged garlic extract can be effective and tolerable treatment in uncontrolled hypertension and may be considered a safe adjunct treatment to conventional hypertensive therapy. Here is another study. Come out in 2018, the effect of Kyolic aged garlic extract on gut microbiome, inflammation, and cardiovascular markers in hypertensives. These individuals recruited 49 people. They gave them a placebo. They gave them aged garlic extract. What do they find? Aged garlic extract significantly lowered blood pressure and pulse pressure and arterial stiffness. In other words, their blood vessels became less hardened, if you will, more rubbery, so they opened up more. And that's a good thing, by the way. You want to have your blood vessels nice and rubbery so they can open up more in response to exercise and stuff like that. Conclusions. Kyolic aged garlic extract is effective in reducing blood pressure in people with uncontrolled hypertension. Again, this study also noted that it appeared to improve the microbiome as well. Again, that's another topic for another day. But this is a supplement that I've been talking about for several years. They don't pay me to say this, guys. I'm not getting endorsed. I'm not getting paid by this. This is a product that I actually take myself for a variety of reasons. Again, I'm healthy, but I want to stay that way, and this is one of the things that I take. And so it might be something to take a look at. Again, I have a review of Kyolic aged garlic extract research on my website, which I will put a link in the description, along with the description to the full review of blood pressure supplements and other things you can do as well. So check that out for more information and see the links that I put in there for the references as well. If you have any questions, guys, leave a comment below and I'll answer you myself. Hopefully this has helped you get a better idea of blood pressure and some things you could do to help reduce your blood pressure. Again, I'm Joe Cannon. Have yourself a fantastic day, and I will see you next time. Take care. Bye-bye.